If you or someone you love has struggled with bipolar depression or intense irritability, even treatment-resistant depression, you've probably heard of Lamotrigine, also sold under the brand name Lamictal. It's one of the few medications in psychiatry that people often stay on for years and for good reason. But it also comes with one big red flag that everyone needs to know about. So in this video, I'll walk you through what Lamotrigine is supposed to do, who it helps most, and what to watch out for, as well as my personal approach as a psychiatrist who's prescribed Lamotrigine to thousands of patients. I'm Dr. David Danish, a double board certified psychiatrist specializing in child, adolescent, and adult psychiatry. Lamotrigine is FDA approved to prevent depressive episodes and bipolar disorder. That's important. Lamotrigine does not treat manic episodes, nor does it actively prevent them from occurring in someone with bipolar disorder. It's also not a quick-acting antidepressant, such as ketamine, let's say. But for people who live in the lows of bipolar depression, it's one of the best options we have for long-term protection mirrored with lower side effects. Off-label, I also use Lamotrigine for treatment-resistant depression in some cases, especially when emotional reactivity, irritability, anger are a part of their symptom presentation. I also use Lamotrigine for chronic irritability in teenagers who may be diagnosed with DMDD or intermittent explosive disorder. I also may use it in adults who have depression with migraines because there's some benefit in treating migraines. In terms of mechanism, Lamotrigine reduces excess glutamate and increases GABA activity. Think of that as a stabilizer that helps quiet noisy brain circuits, especially when those circuits lead to intense mood swings or intense emotional reactivity. Now, let me dive into some side effects. One of the greatest things about Lamotrigine is it tends to have way less side effects than most other psychiatric medications, let alone psychiatric mood stabilizers. But there are things to watch for. So, in the early days, some of the minor side effects I tend to see: mild headache, mild dizziness, mild insomnia. Again, I don't see it very much. Part of that is because we start so low on the dose. Even more rare, but deserving mentioning, are blurred vision, mild tremor, mild coordination issues, and dry mouth. Some people may get rhinorrhea, which is cold symptoms, runny nose, or a sore throat. In very rare cases, Lamotrigine, along with Trileptal, along with Depakote, sort of the anti-seizure medications that also work on mood. I may see some diffuse hair thinning, but we have ways to prevent that as well. Now, one of the most important, or the most important side effect I want you to know about, which is the reason I'm so happy I made this video, is the skin reaction known as Stevens-Johnson syndrome that can occur at a higher rate with Lamotrigine than it does with other medications. And this is why with Lamotrigine, it's so important to dose it properly. We start low and go up slowly. We start at 25 milligrams every time, and you increase every 2 weeks, assuming no side effects, of course. Now, let me talk about the rashes. So, the most common rash with Lamotrigine is a benign drug rash. Benign meaning it's not something that's dangerous. You probably have to stop the medication and let it go away. That would be a diffuse maculopapular rash, red, sometimes a little itchy, sometimes not, and it goes away as you stop the medication. That is not the risky rash I'm worried about. In the research, that rash can occur in up to 10% of patients. In my experience, it's much less than that, more like 1 out of 50, but it can occur and it's not uncommon. But the risky rash, the Stevens-Johnson syndrome, or SJS, is much more rare. 1 in 10,000 usually, even less so in most cases. In my cases, I've never seen it happen with any of the patients I put it on, but I have patients I work with who have had it happen to them prior to working with me, usually because it was not dosed properly. Also, for patients of Asian, South Asian, or Pacific Islander descent, they have a higher genetic risk of this, and so genetic testing should be done for something called the HLA-B1502 gene, and I'll make sure you have access to that written down. Another quick caveat here: if you're on Lamotrigine at the dose that's working for you, if you miss more than 3 days of dosing, you actually have to start over from the beginning at the lowest dose, otherwise you run the risk of causing that rash. Even though you were used to it at that higher dose, your body is no longer used to it. Now, another thing to be careful about with Lamotrigine is when you're using other medications as well. Usually it's the case where Lamotrigine actually lowers the effectiveness of those medications. It's not where those other medications increase the risk of the rash in most cases. So an example would be oral contraceptives in women. Sometimes, in some cases, depending on which medication they're using for the oral contraceptive, Lamotrigine may lower the effectiveness of that. So be careful there. Also, high-dose folic acid can reduce the effectiveness of Lamotrigine in some cases. L-methylfolate seems to be safe. Some antibiotics, some antivirals need to be looked into. Your provider should always do a medication interaction check before giving you antibiotics or antivirals if you're on Lamotrigine. Also, theoretically, Lamotrigine may lower the benefit of ketamine or Spravato. It's still up for debate and hard to know, but it's just something to think about. Now, getting back to the Stevens-Johnson syndrome. These are the red flags to report immediately. Rash, especially with fever, mouth sores, eye irritation, malaise, almost like a flu. Now, this rash is unique in the sense that it tends to hit your mucous membranes. What that means is it tends to occur in or around the mouth, the nose area, the eyes, the palms, the soles of your feet, your pelvic regions. So it's a unique rash in that sense, and it tends to form blisters that then slough off. And again, usually it's occurring with flu-like symptoms, but the symptoms can vary, so I don't want you to say, oh, I have this weird rash, but I don't feel like I have the flu. Let's not worry about it. No, if you get that rash, no matter what it is, even if it's a generalized drug rash that is not Stevens-Johnson syndrome, contact your provider. Usually what I tell my patients is go to the urgent care, go to the ER, go to derm if you can get in today so we can know for sure. I don't take chances. But also to help you with this, I provided a free MindVault resource that shows all of the potential symptoms, what they look like visually, and I'll make sure to give you access to that in the show notes. Lamotrigine is one of my top and favorite recommendations for patients with bipolar 2 who have long depressive episodes, or people who react poorly to other mood stabilizers I use for bipolar 1 depression, such as meds that cause weight gain or over-sedation or that cognitive dulling. Also, patients looking for a steady, long-term solution that's metabolically neutral. Some cases of atypical treatment-resistant depression, I'll use it in those with irritability or anger issues or just intense emotional reactivity. It won't make things better overnight, but it lays the foundation. I tell patients this. Lamotrigine is like building a brick wall between you and your next depressive episode. I usually titrate it up to 150 to 200 milligrams daily, but that varies quite a bit depending on how well someone's responding, their age, and the dose ranges really can be anywhere from 100 on the low end, that's very low, to I have had some patients who had to go up to 400 milligrams in a day. If you're starting Lamotrigine or just considering it, make sure you're informed and protected. Again, inside my MindVault at drdaviddanish.com, you'll find a full breakdown of Lamotrigine dosing and real-world strategies to mitigate those side effects, the name and how to test for that genetic predisposition to Stevens-Johnson syndrome, and of course, all of the symptoms of Stevens-Johnson syndrome, including pictures to help you along. I also created a full-length YouTube video on Stevens-Johnson syndrome because it can come from other medications as well. It turns out that Lamotrigine is the most common cause, but there are many other medications that can do it, including Lamictal, for example. Please hit the subscribe button. Please like the video. Please share this so we can get the word out there. This is so important, and I know it can save lives. Thank you for watching, and I'll see you in the MindVault.